Men in particular are really bad at going to the doctors. They hate doing so. They hate pain. Everyone hates pain, right? So a urine, it's a non-invasive test kit, and it lets people get an immediate, instant result and in easy to understand words. So people want a binary response to a binary question. Am I pregnant? Have I got a UTI? Have I got diabetes? Yes or no? And that's what this does. It tells them.
The startup investment landscape is changing, and world-class companies are being built outside of Silicon Valley. We find them, talk with them, and discuss the upside of investing in them. Welcome to Upside.
Hello, and welcome to the Upside Podcast, first podcast finding upside outside of Silicon Valley. I'm Eric Hornung, and I'm accompanied by my co-host, Mr. Korean Barbecue himself, Jay Klaus. Jay, how's it going, man? What'd you think?
There's a first time for everything, my friend, and last night was my first time having Korean barbecue.
I'm glad that I could take your Korean virginity. What?
Well, that makes me very uncomfortable. But Korean barbecue uses a mechanism that's not quite hibachi, it's nothing like Mongolian barbecue. It's all very different. They basically say, here's some raw meat. We're going to give you a very hot stove in the middle of your table, and the rest is on you.
Right. And they also give you banchan, which you thought was pretty interesting.
Is banchan the little bowls of stuff?
Yeah, banchan's the little bowls of stuff around the outside.
The most exciting part about the banchan was I'm a very much a completist type person.
Yeah.
Once I start something, I got to finish it. So at one point, I saw there was a couple pieces of tofu banchan left, and I said, I'm going to finish that. And I did. And she said, do you want more? And I did. So she brought more, but I didn't finish that. I didn't realize it was a Olive Garden bottomless breadsticks type situation.
Yeah, you're definitely just picking at that while you're also eating your food and you're mixing it all together. It's good stuff.
That bulgogi, which we didn't even realize was meat at the beginning.
Yeah, I didn't know what that was. But once you throw that on the grill, that was good. I think that was the best meat there. I like the filet the best, but I'm a filet guy.
Yeah, that's fine.
What did you think about the soju?
Soju, which is not unlike sake, but not sake, was good. Very smooth.
Yeah, I thought that was pretty good. We wanted to get the premium soju, but they were out, so we got the standard, and the standard was still really good.
Still pretty good. Still better than your well gin and tonic, which is the staple of my alcohol diet.
Yeah, it's weird that you drink so much well gin and tonic.
Why is that weird?
It's just like, I don't know, what are you, 22?
No. It gets the job done.
That's true. I mean, but after a couple of those, you definitely wouldn't like pass an alcohol test or anything like that.
I get well most things, unless I'm drinking it neat. Whatever it is, neat. If I'm just going to get a mixer, I don't care. I'm going for pure utility at that point.
I'm a red wine guy.
Yeah.
Yeah. We're talking a lot about alcohol here. Can you detect alcohol in a piss test?
I think you can.
Really?
Right?
I don't know.
I don't know either.
Guess we'll find out.
Speaking of piss tests, today we are speaking with Luke Heron, the co-founder of Testcard. Testcard is a medical diagnostic test contained within a traditional postcard. This unique patent-pending flat pack product is embedded with 3 fold-out urine dipsticks. The accompanying mobile application turns a mobile phone's camera into a clinical-grade scanner and provides the user with an immediate and accurate result from the test card, communicated in easy-to-understand language on the phone screen.
How am I supposed to conduct an interview and say the words fold-out urine dipsticks?
I love it.
It's going to be really hard for me. I'm going to laugh a couple times in this interview.
Have you ever seen the movie Donnie Darko?
I have seen the movie Donnie Darko.
One of my favorite parts of Donnie Darko is when Drew Barrymore says the 2 most beautiful words in this English language are cellar door. I would argue that fold out urine dipstick should be in the conversation of the most beautiful phrase in the English language.
I like that. I like that a lot.
The company was founded in 2017. It's based in the UK. They've received almost $2 million in funding to this point. And before we got to CES, which is where we're recording this, we're here in the Blue Microphone podcast suite. Before we got to CES, I got an email from Luke pitching us on being on the podcast. And we were walking around the show floor yesterday, ran into him and said, hey, I got your email. Super interesting product. He showed us a quick demo of the postcard, which is literally a postcard. And we said, that's interesting. Let's get him on the show. Didn't ask him a lot of questions. Save those for the interview. Maybe we'll do a live test on the show.
Jay, are you going to do a live STI test on the show?
I was thinking I would do a live pregnancy test on the show.
There you go. That one I think we'll know the answer to.
I don't know. I don't know what they have available, but it seemed like they have something close to 8 different tests that they can provide right now, which it looked like a pretty compelling product to me. The idea that you get this test in the mail, you do your business in a cup, you dip the postcard paper into it, you use your phone scanner to give you an immediate result. I think you're seeing a trend here of privacy and what people want in their products, especially as it comes to medical related things.
Yeah, I completely agree. Well, let's learn a little bit more about dipsticks in this interview, and let's hope that soju doesn't show up on the on the test, okay?
If you guys have any thoughts on this episode, which I'm sure you will, please tweet at us at UpsideFM or email us hello@upside.fm, and we'll get into this interview here with Luke.
Hey guys, wanted to cut in here real quick and let you know about something Jay and I have been getting ready behind the scenes in 2019. When we started this podcast, Jay and I said that you, the listener, would have an opportunity to learn in real time, to think like venture investors with us as we meet a wide variety of personalities and examine a wide range of industries. Well, now we're going to share something new, and it's a little different. This new idea is called The Update. It's a carefully curated quarterly publication of editorials, trends, and stories happening outside of Silicon Valley. Jay and I will be writing stories about what we're learning about on the podcast, have guest editorials on interesting topics, and share news and updates from our podcasts. In some cases, we may even share some exclusive content or first looks. Our goal is to stay at the cutting edge, and of course, bring you along with us. We're super excited about it and know you're going to love it. If you want to be the first to hear about our Q1 launch and subsequent letters, go to upside.fm/update to get on the mailing list.
Luke, welcome to the show.
Thank you for having me.
Great to have you here at CES. Pretty cool experience thus far. It was awesome we ran into you yesterday.
Yeah, that's right.
Got to stop by the booth and actually see the cards.
Yeah, it's great.
So on Upside, we like to start with the background of the founder. So can you tell us about the history of Luke?
The history, Luke. Okay, well, I'm a high school dropout. I left school when I was 15. I then ended up stuffing envelopes at a investment bank, which got acquired by Merrill Lynch. And I ended up spending 6 years there, ending up on the private client trading desk, which was an unusual way of ending up in a job which I think most people on my desk had at least one degree. I then felt I'd missed out on university, so wrote a very pompous admissions essay and got accepted into St Andrews University in Scotland. At the same time, Prince William was there, incidentally, but I didn't actually believe he went there for at least 6 months, because I never saw him. The only evidence was the sort of Porsche Cayenne driving around St Andrews. And now I've been involved in a number of startups since then, really. So I did a fintech startup when I was at St Andrews, which I sold. I dropped out of university. I'm afraid I'm a serial dropout, really. So startups...
Don't leave us, man. We need you for at least another hour.
Startups are the only thing I've managed to sort of stay at. I mean, I've had loads of failures. I've had at least 5 companies now that have gone belly up. I think you say up. I'm not sure if you can say that on the show or not.
We'll go both.
Up and belly up. Yeah, and so I've had a couple of small exits, but Testcard is where I'm at now and have been for the last 18, 19 months.
I want to ask a question about, we'll get to Testcards in a second. You hear about these people who start in the mailroom and then make their way to a trading desk, and that happens a lot in finance, or you hear the story about it, but this seems like it actually happened. I've never actually had what does that look like? Like you all of a sudden you're packing envelopes, then all of a sudden you stumble on the desk and you're...
Yeah, I wasn't just stuffing envelopes. I was also, Merrill Lynch, the letters had to have a signature that looked real. So we had like a hand stamp, and I used to take great pride in sort of smudging the tail of the signature to add that extra level of authenticity. So I think someone clearly spotted my fine attention to detail and allowed me to climb the ladder a little quickly than most people. But no, I did a whole bunch of jobs at Merrill Lynch. I ended up on what's called the checking desk, where you're sort of checking trades that have happened in the previous trading session and making sure that they settle quickly. And then I ended up on a best execution area, and then ended up in private clients really by accident. But yeah, it was a an interesting 6 years, five, 6 years.
What is it about the education system that just wasn't for you? Why were you like this?
I was a rebel. I think education has definitely changed a lot since then. I mean, my kids love school, so I've got 3 children, 2 of whom are school-age kids, and they absolutely love going to school every day. I hated it. I thought it was a waste of time. Either it was something that was interesting and it's a subject, if I wanted to know about it, I'd go and find out about it myself, and if I wasn't interested, I wouldn't pay attention. So I think the whole one-size-fits-all approach with education has got to change. I mean, I think that's going to be the next massive area that needs to be disrupted is kids education, not university, but kids education.
So what types of things were interesting to you at the time that you were doing instead?
Entrepreneurship. I loved entrepreneurship from a really early age. I set up my first business at the same time as I left school. So I set up a company which sold magic coin tricks. There's a magazine called Abracadabra which sells. I was interested in this sort of thing back in those days, but there was an advert where a guy was making precision coin tricks. So he was sort of he had a lathe and he was sort of chipping away at these things. So I got in touch with him and repackaged his sort of wares and started selling those. And when the internet came along, it was open season for that and for many other things. So yeah.
Talk to me a little bit about some of the things that went up that didn't work out for you. What were you trying?
Okay, well, probably most notably, I had an app called Bypost, BYPOST. So it was a postcard app. It let you take a picture with your phone and send it as a real printed postcard. That got funded. It had incredible traction. It was actually, at one point, it was on 5% of iPhones in the UK. Had hundreds and hundreds and hundreds of thousands of downloads in the UK, and globally it was number 1 in 22 countries in the iOS chart. And that's not in a category, that's overall. In lifestyle, I think it was number 1 in 50 countries. So it had incredible traction, but I was never able to build a team that was either one on my side. I mean, unquestionably, its failure was entirely down to me, but having a cohesive team and making sure that everyone is on the same page and wanting to execute the same vision and grow the company in the same way and shares your ambition is really important. And I should have been more ruthless early on. I wasn't. But I mean, the app still exists. It belongs to low note holders. As is typical, you can get funding with equity, you can get funding with low note holders. So I had secured low note holders, and they ended up owning the assets.
One thing that we hear from entrepreneurs is this kind of fear of failure, and like the idea of failing and like ruining your reputation if you take on funding and fail. But one thing we hear from investors, or I've heard from investors, is that's not going to hurt your reputation. You took on funding and it went up. What does that mean for your reputation with the investor community in your kind of area?
That's a great question. I love that question. I've never actually been asked that before. I mean, I guess it's something, reputation is something that everyone worries about more than anything else. For me, I still keep in touch with the investors that ended up owning the assets just by virtue of their secured loan note. In fact, I visited them at their office to try and help them with some technical issues only about 6 weeks ago. So, and that's like 2 or 3 years after its failure. So I think people understand, don't they? I mean, I guess, I mean, in the UK, we've got a completely different ecosystem, really. I mean, America is a far better country to... I've got to be careful what I say here, actually. Americans generally embrace entrepreneurship in a far more pragmatic, open-minded and positive way than Brits do. Brits are, I think, on the whole, pretty bad at failure. Generally, I think they're also bad at success, and by bad at success, I mean we've got a terrible history. History is littered with British companies that have exited way too early. This hold forever mentality in the States, epitomised by Zuckerberg, really hanging on to Facebook as long as he did. You know, I think that you'd never have had that story out of the UK. I mean, Facebook could easily have come out of any university, including a British one, but it would have exited to Yahoo for the $1 billion. It would never have. So in terms of reputation, you know, I'm sure if you look on the internet, I haven't Googled myself in a long while. I learned to stop doing that a long while ago. But I'm sure that there are some definitely disgruntled customers from cards that didn't arrive, but I'm not sure about from an investor reputation. It's not had any issue with Testcard at all. But this is the first business I've been involved in where I've had a co-founder. So I'm not carrying the bag by myself. I'm sharing the load this time.
Where are you from in the UK?
So I'm originally from North London, a place called Muswell Hill, but I live in North Yorkshire now. Our business has a small office in London, but the thing with a startup, especially one that attracts investment and then has an ongoing requirement for investment, you end up spending most of your time traveling anyway to events like this, to pitch your product, to look for money, to look for media coverage. You've got to whore yourself everywhere and in every way you can. So I'm very rarely in Yorkshire.
I see a little bit of a tie-in, and maybe it's perceived and not real, of by-post involved postcards. Testcard is on the size and sort of form factor of a postcard.
It is.
Was by-post directly before Testcard, or were there other attempts leading up to this?
No, I mean, there was definitely a break between by-post and Testcard, but it's kind of coincidental, I guess. No, you're right. I mean, Testcard is effectively a postcard in the mail, so but it's a very, very different product. Testcard's a diagnostic, and by-post was a sort of a printed photo on a card.
Before we get into Testcard, I wanted to touched on a little bit of the failures.
Yeah, sure.
You mentioned when you were at St. Andrews, you sold a fintech company.
Yeah, I probably exaggerated. Yeah, well, it was a small success. It was tens of thousands rather than hundreds of thousands, and certainly not millions. But when you're a student, but I should put this in context. I went to St. Andrews after I'd been to Merrill Lynch, so I'd already had a period of time where I'd had a decent six-figure salary at the time I left Merrill Lynch. Well, in the last year, I cleared six figures, which was a lot of money 20 years ago. So. 18 years ago. So, St. Andrews, I ran out of money fairly quickly. So when someone was offering some money to buy it was effectively a PHP bulletin board. It was just we have a sort of a venture capital retail market in the UK. So there's sort of a London Stock Exchange, there's AIM, and then there's what was called OffX at the time. And I had a website called FinfoX, which has long since been disbanded. I think it got sort of swallowed up and integrated into other websites. But that I built up when I was at St. Andrews, and I was fascinated by the stock market, and that got acquired. So that was a success. But I've had a couple of other exits. I had a company called Green Baby, which was sort of an organic clothing company, which I exited to a family office in London. Again, I mean, it wasn't a huge success for me, and the thing with that one is other people lost money, so I did well out of it, but the company ended up folding, I think 2 years after I sold out. So it's not one of these successes where you've started a company, you built it up, you've exited, and then it's still around, and you still sort of bathe in the glory of a company which is still trading.
All of these seem like such disparate ideas, so it's clear to me that you have wide-ranging interests, and you can pick up and learn something to a pretty high level pretty quickly to do these things. How do you determine where you want to spend your time? Because it sounds like you could probably get interested.
I was highly opportunistic. So I mean, we're focusing on a period of my life was about 5 years. So FinfoX and Green Baby were in a 5-year window. The last 8 years has been two companies. One was by-post, and now it's Testcard. So I think when I was doing Green Baby, I went through a period of time where I did a number of deals. I guess a little bit confused. I thought I was a deal flow guy, but I think at my heart I've always been an entrepreneur, and creating something, making something better has always been what I've wanted to do. And it's been a fairly convoluted route coming around to a point where I've got a product that actually works.
So let's talk about that product. What is Testcard in your own words?
Testcard is the disruption of healthcare. It's a flat pack urine test kit that arrives in the mail, and using the technology which all of us carry around in our pockets, our mobile devices, it repurposes this tech and uses the camera on your phone to read a urinalysis dipstick. So whether that's a colorimetry-based test or a densitometry lateral flow test, it removes the science and allows a layperson to get a diagnosis for UTIs, for pregnancy, for diabetes, using urine. Men in particular are really bad at going to the doctors. They hate doing so. They hate pain. Everyone hates pain, right? So a urine, it's a non-invasive test kit, and it lets people get an immediate, instant result and in easy to understand words. So people want a binary response to a binary question. Am I pregnant? Have I got a UTI? Have I got diabetes? Yes or no? And that's what this does. It tells them, without the science, it tells them whether or not they have.
I would love to hear how the inception of this came about. How did you say, you know what, I think I want to take on diagnostics for diseases, for conditions, in-home test strip?
Okay, so my co-founder in this, Dr. Andrew Botham, is the head of blood science for the NHS in East Yorkshire. It's a region in the UK, and his kids go to the same school as my children, and we were talking. We didn't know what each other did for a long time, but then we ended up talking about how bad men are at going to the doctors, and specifically to do with prostate health. And we were both fast approaching 40, and you get a letter in the UK when you hit 40, and it involves the start of a rather unpleasant prostate health examination. So we were wondering how men who avoid this test, how we could create a test that would, I guess, get men to be more invested in their healthcare. And so we created a urine-based, so it's non-invasive, test card that measures PSA, prostate-specific antigen. I should say that this test kit is not on the market, and its regulatory route to market is a very, very long one. So the products that we are launching in the US in July this year, which pregnancy, UTI, and diabetes, they're a much simpler process to get through past the FDA than something that's new like PSA, because PSA has traditionally been tested via blood draw, whereas we're doing it with urine. So yeah, it's that. I mean, that was the inception moment. It was a conversation with a dad at my kid's school.
And how, in your test to this point, how efficacious is urine testing versus blood testing? Like, if it can be done with urine, why hasn't it been done with urine?
I guess with the products we're launching in the first instance, we're only launching products where urine is the standard anyway, rather than blood. So pregnancy is not really something you'd have a blood draw, neither is UTIs, urinary tract infections, and I guess diabetes is really the exception, but we're not really offering a diabetes diagnostic. We received a letter of intent from one of the world's largest health insurers, Aetna, to roll out Testcard globally, and aside from being an incredibly massive game-changing moment for us, they had a very specific want from us, and that was a diabetes screen. It was really a glucose screen that they could send out in a cost-effective manner in India to screen a lot of people at a lot of time. And what they wanted was absolute assurance about when we say someone is negative, that we're absolutely sure that they're negative. False positives are kind of less important, because if you say someone that's positive that isn't, the worst that happens is they go and have another follow-up check, right? But if you tell someone that they're negative and they're positive, that's a real problem. So we've created a test card product for Aetna in order to screen lots of people in India, and that's the intention, that we're doing this partnership with them right now. So later this year, they'll be sending out hundreds of thousands of test cards across India to their customers. They've got a V-Health platform that people will be able to test at home and share those results and get a follow-on appointment if they need one with a GP, with a doctor.
How would this have been done before? Like, if I wanted to get all the tests that come in a test card, what would the process have been for me to go do it?
If you wanted to do it, the dipsticks that we feature on our card, they're sort of a kilometry perimeter pads, which everyone will have seen, I guess, in one form or another, probably in a doctor's office. You can buy them on Amazon, so you can buy like a pot of 100 for $10. So you can buy these, but at the moment the process is you would take one of these dips out and you'd dip it into a urine sample, and then you would hold it up against a chart again of colours to compare using your eyesight about how those colours have changed. There's a few problems with that, one of which is that your eyesight and mine are different. It's highly subjective. Secondly, you have to dip it for the right amount of time. You have to let it develop for the right amount of time. So reading it at the optimal time is critical to getting an accurate result. So what we've done, the sort of proprietary process which we built within our application, it removes the ambient interfering light. So it turns the camera into a clinical scanner and removes the interfering light, and then reads the result with zero subjectivity. So it's giving you a result that is precise.
But people aren't typically doing the Amazon route, right? Like, I didn't know that was available to me. Most of this tests in here, I would probably going to a doctor.
No, but I guess that most people probably wouldn't. I don't think people would, for the very reasons it's just too scientific. The reality is that we've de-scienced it. We've embedded these test strips that are available into our own form factor, and we've made it possible for people to do at home. They don't have to have an understanding of colorimetry.
When did phones get good enough to do this? Like, Jay has a iPhone 4 or something.
It's a 7, whatever.
Well, he's fine with the 7. It wouldn't work with the 4. So iPhone 6 and onwards is really the point which Testcard became possible, which was around the same time as we were beginning to develop this anyway. So But I mean, the iOS market. I mean, with a product like this, it's best to develop for iOS first, and then you port over to Android. And the problem you've got with Android is there are just so many variables of Android devices. So the problem we're trying to solve, by the way, is the inaccessibility of healthcare, and that's a problem globally. So whether that's healthcare, people are isolated for geographic reasons, they live in the middle of nowhere, but whether it's for social reasons, there's some stigmas attached to some diseases, whether it's frailty, elderly population, or disability that's preventing someone from leaving their home, or economic isolation. I mean, healthcare is prohibitively expensive, especially here in the US. So we've developed a product that will retail at $3.99. It has 3 tests. It's as accurate, if not more so, I would say, than going to your doctor. And the only reason I say it's more so is because doctors are notoriously bad, I think, at making sure that the dipsticks that are sitting on their desk are still in date. That's number one. Secondly, it's not on the syllabus to become a doctor to be able to read these. It's pretty simple to be able to do it, and that's what they all think. But invariably they don't do it properly, and they don't throw them out after you open the can. You've got to chuck it after 30 days, and most doctors won't get through 100 dipsticks in 30 days, so they'll keep them.
So when I get this for $3.99, I get 3 tests. Is it 3 tests on 1 dipstick? Is it 3 different dipsticks?
It's 3 dipsticks. So you get a test card, and it's got 3 strips, and they easily pull out. And they pull out. You dip it into a urine sample, and then you use your phone to read it.
And those tests in that card you just showed us, those 3 tests are which ones?
This is a glucose screen. So this was the test card that we've developed in conjunction with Aetna, and this is what's going to be coming to homes in India in April.
Why 3 for the glucose screen? Is it like just a margin of error?
No. There's no particular reason. I mean, we could send people 1. I guess if they were. I think really the reason is it started with pregnancy, right? So the first test that we produced after developing PSA and realizing the regulatory route was so long, pregnancy was the first thing someone does when they're taking a pregnancy test is take another one. So they want absolute assurance that the result is correct. So we put 3 tests in there because, 1, there's no additional cost for us to make 3 in there rather than 1. Secondly, doing 1 test, you might as well just do another one straight away afterwards, which most people do anyway. And then just adding 1 extra is for whatever reason. I mean, someone can retest themselves a month later if they want.
Give it to a friend. The FDA route that's so long.
Are you talking about for PSA or for anything?
So could you go to market with a product that tests this and you say like, hey, we're not guaranteeing 100% accuracy, but here's something that will give you a good feeling of whether you should go to a doctor and just do that tomorrow?
We can launch a drug screen right now with 0 regulatory approval. So yeah, it's, if you're not asking a medical question, if there's not a medical outcome, then the FDA doesn't really care. They don't really get involved. So there's a drug screen product that we intend to bring to market much sooner. I mean, it's ready to go now, but that's sort of a 12 drug screen. But in answer to your question, I guess we could do some clinical trials. So you could launch in the US via a clinical trials process where participants would be generating results knowing that the results were not part of anything larger than a clinical trial. They're not designed to inform an action that they should take, but absolutely it is right and proper that the FDA does get involved with medical testing because we have this in the UK. It's a CE mark that you need to launch these products in the UK, but I mean it's absolutely critical that there is oversight. The idea that there would be some unscrupulous operator in this space. I mean, in the US there's a very famous case of a blood testing company relatively recently that was making some fairly grandiose claims, and I think we don't want to be one of those. So we'll play by the rules, and we'll make sure that everything that we say can be validated, authenticated. We don't want to be a flash in the pan. We want to be around for years to come. So we've got to do stuff the right way.
Yeah, I was thinking about Theranos, which is I think who you just referenced.
You remember the proper noun?
Well, yeah, I'm good with company names. I'm terrible with proper nouns.
Oh, really?
Like, I already forgot your name. Just kidding, I didn't, because it's on the screen over there. But I am very bad about proper nouns, but company names for some reason I can remember. So
that's great.
A quick aside there. This FDA process, I'm still a little fuzzy on what that looks like. And is this, you mentioned, if it's a medical decision, then it has to go through the FDA. Is this a medical decision? Help me understand that for each of the tests.
I'd love to hide behind my usual funny quip, which is I'm only the CEO, so I don't know the answer to this question. But I think it's a 501k. So my colleague, Dr. Andrew Brotham, is the guy that's dealing with the application process. But I'm pretty sure it's a 501k or 510k. But basically, there's a product of similar performance on the market already. You can piggyback off the tech that's already there. And there are some people that are doing broadly similar things in this space. They haven't solved all the problems that we have. So the removal of ambient interfering light is the major issue with this. Making sure that when you read a result, the biggest impact into especially a kilometry-based test is if you read it in a bright room or if you read it in a dark bathroom, is the phone going to deliver precisely the same response for both? And the answer with our app is yes. That I don't think any other company would be able to say that. So in terms of our route to market, with products that have a generally lower level of worst case scenario, and worst case scenario is really determined by what is the worst thing that can happen if you give someone an incorrect result, right? So if you told someone they're pregnant, they're not, or you told someone they weren't pregnant, they were, it's not catastrophic. They're gonna know. Again, with UTIs, by the way, I'm not forgiving delivering a wrong result to anyone. The intention is that Testcard will never deliver anything other than correct results. In fact, what we built into our app is a mechanism whereby if we're not absolutely sure, we invalidate the process. And guess what? You've got another 2 tests to do anyway, so it's great. But with the FDA process, we've got a fairly good visibility to launching in July through this. I think is it 510k, 501k, and that's just for these first products. It's for UTI, for pregnancy. But for other stuff, it's going to take a hell of a lot longer. The PSA test, prostate-specific antigen, that process is unknown. There'd be utterly pointless for me to guess when we'd get approval for that. But it's something that we've got a working product. People can play with it, but it's not something where we can sell.
Is that ambient light, I'll call it a competitive advantage because it sounds like that's what it is. Is that protected in any way? Or
we file patents. So again, I'm not hugely familiar with the patent landscape in the US, but we've got US lawyers here. We filed a provisional patent, which then gets replaced by specific design and utility patents. So yes, I mean it's a bit of a scattergun approach, and I think any company that pretends that it's anything else is lying to themselves, really. I mean, when you've developed something innovative at the start, you want to protect it, right? So you want to go after anything and everything that you can in order to protect your competitive advantage. But with us, we have no idea what we're going to be able to get through. So we filed a bunch of things. We think one of the most important, the design patents really are very rarely worth the paper they're written on. But I think with this, design is important. We developed a flat pack postcard that comes through the mail, and it's got a really easy pull-out test strip. You guys have seen it. I hope you think it's easy. It's an easy way of delivering a test card in the mail. So design is important for this, but utility, is what you're referring to. Removal of ambient light. Yeah, I guess. Let's hope we can get something.
If I am a woman who is worried that she might be pregnant, or the boyfriend of a woman, and we're both worried that she might be pregnant, we want that pregnancy test like now, right? So what's the shipping time on something like this?
So the idea is that you order it in the app on the web. We hope to be stocked in Amazon, so it would arrive the next day. I don't see why it wouldn't. We hope to have some retail distribution. Aetna's been acquired by CVS, right? So I would like to think that we could lean on that relationship, assuming we don't really piss them off. So we're going to lean on the Aetna relationship as much as we can. So if we can get rolled out in CVS, we'll be doing that.
So is Aetna and insurance companies your major customer here? You mentioned $3.99 a pack. Are you trying to go directly to consumer for the most part, or are you trying to roll
$3.99 is direct to consumer, and I can assure you Aetna won't be paying anything close to that price. So yeah, especially in India. So yeah, $3.99 is the US price, and we think that's disruptive. I can't remember who it was that said the definition of it's this 10x rule, isn't it? It's about making something 10 times cheaper, 10 times better. So we think that what we've developed is 10 times better than anything on there, and it's certainly, it may not be 10 times cheaper, but it is peanuts.
So that's a question I had on pricing, because when I think of medical devices, I think expensive, right? $3.99 seems really cheap to me, and maybe I don't think really expensive. Maybe I think really big margins in medical devices.
Yeah.
And $3.99 seems cheap. So are your costs so contained that you're still capturing a large margin, or is this...
We can talk about that a little bit, actually, because I like the idea that we could be transparent. I don't think there's a huge amount of commercial sensitivity in the pricing, because clearly, it costs us between 1 cent and $3.99 to make this product, so we're not going to be losing money on it. So the dipsticks, themselves, I mean, you can work it out. So you can buy 100 dipsticks on Amazon for like $10. So I think you can safely assume that the margins on the dipsticks, I mean, it's possible to make a dipstick for under a penny. So, taking that as a case in point, then all the rest of it is just cardboard. So it's fairly safe. I think anyone that can do a back of a napkin calculation and work out that at scale these things aren't costing us more than 20 cents, 25 cents. $3.99 offers us a fairly generous margin, over 95% gross margin. But for us, that profit margin is really going into developing other products. For us, our longevity is going to be based on coming out with new things.
It almost seems that price point is so low that I wonder if human psychology, a lot of times we use heuristic as like a placeholder for quality in some ways. I wonder if some people will have some trepidance just because it's so cheap.
Well, maybe this interview will come back and haunt me, and we'll end up releasing it at $9.99. I don't know. I mean, at the moment we think $3.99. We think affordability is the critical thing. So, especially in the US, I mean, so many people get legged over with insurance here, with healthcare, and the idea that we can make it accessible to all. I mean, that really appeals to me. I mean, it may not be. I am, don't get me wrong, a complete capitalist through and through, but the idea that we can level the playing field is, I think, really powerful.
What's your go-to-market strategy to go directly to consumers with this?
Carefully, I think is probably the right answer. I have some experience in mass adoption with Buy Post. It was not a commercial success, but it had millions of downloads. So I think we're getting traction. It's one of those products that I think actually via social media is probably a really easy sell. Facebook knows everything about us. I think being able to target people that may be interested in testing for a UTI, for pregnancy, for whatever, I think is a fairly simple thing to be able to hone down on people that would be interested. I mean, if you're targeting UTIs, you'd never target men, so that's immediately you've honed down on half the population, and thereafter, targeting women, postmenopausal women, you're going to be getting a market that's fairly rife with UTIs and want to find out. So yeah, I think our preference is partnerships. So the channels that we're going after are healthcare partnerships. So in the UK, we're working with the NHS already. So we've got a memorandum of understanding with one of the largest trusts in the UK, and they're trialing we've built a test card for the NHS app, which is being trialed now. But we've got another product the NHS which we're working on right now, and commercial partnerships like with Aetna. So we've got a call with Merck. We were approached by it. So we were at TechCrunch Disrupt in Berlin in November. As a result of that, there was an article in Apple Insider, and then Apple reached out to us out of the blue. And in the past, I've never been able to get hold of them, get a call with them. And then, when they want you, it's they know exactly how to find you.
We know your phone number.
Yeah,
we're going to send you the biggest push notification you've ever seen.
That's great. But yeah, so they're all over us at the minute. So I think in terms of what that all over us will end up looking like, in terms of how helpful they're going to be, they're promising the earth right now. It's fantastic. Certainly wanting to play around with the product, which they're doing. Hopefully we can leverage that relationship into something really useful. I mean, Apple has been more proactive, I think, than any other manufacturer on the planet with healthcare. I think it's undeniable. It is.
I was in the healthcare space super briefly, and there's not a tool that has a mass adoption yet where the user owns their healthcare record. And it always seemed to me that Apple was in the best position to kind of build that place where you you go to this doctor over here, this doctor over here, they all have their different specialties. You have a paper medical record in each one of those silos. And every time you go, you have to update it and ask you, have you changed since you've been here? And you don't actually know because you don't remember the last time you've been there. You don't remember what you filled on that piece of paper. You might have gone to the dentist a week ago and just filled out your new information. There's no single thing in your hand that controls your health information. I think Apple's Health Kit is the closest reality to that.
Apple, they haven't lost direction, but they've certainly not had that moment, have they, since the Steve Jobs iPhone unveiling. But I do think they've got a real opportunity in healthcare, and I think you've hit the nail on the head. I think healthcare records, and provided they can keep them safe and secure, which Apple has a fairly good record compared to some of the other tech behemoths, they've not let people down on a massive scale yet. I don't think. I mean, correct me if I'm wrong. If I'm not.
No, I think you're right. It's at least a talking point for them. Is they take security very seriously.
They have a poster. They have a poster here at CES that says pretty much like, "We're not here, but remember who cares about your privacy."
Really?
Yeah, they trolled the entire Google space here.
Really?
Yeah.
Amazing.
Cool. I mean, the other one is Amazon. I think Amazon are unbelievably well placed to deliver healthcare in a way. I mean, their massive advantage is just the connectability that users have. What does it say?
It says, what happens on your iPhone stays on your iPhone.
I love it. Yeah. Yeah, I mean, Amazon is uniquely placed to deliver consumables, especially like ours, because, the reality is, I don't know whether we're going to get to a point where you'll be able to do a finger prick test on an Apple, directly on an Apple device. I mean, it sounds mad now, but you never know. Yeah, I think there's always going to be a consumable element, and I don't think Apple really strikes me as a business that's desperate to get into the delivering consumables to people's homes. So whereas Amazon has that.
They have the infrastructure.
You mentioned like the whole Earth as something that you can tackle. How big is this opportunity? Is it as easy as there's 7 billion people, it's $4 each, if one person does one test per year, it's a $28 billion opportunity, or is it
well, it's $4 here. The reality is we build a regulatory pathway document for pretty much every country on Earth. Over 120 countries, we've got a planned route to market. We're not in this to be small. We want to be the definitive at-home healthcare company globally. It sounds grandiose, but you have to have, I think as an entrepreneur, there has to be an element of delusional ambition, and where delusion stops and where reality takes over, and there's got to be a crossover at some point. And I think we are unashamedly ambitious with where we want to penetrate Testcard into markets. We want to disrupt healthcare in emerging economies that cannot afford a $4 price point and probably wouldn't be able to afford a $1 price point. But the great thing about our product is we can get costs of production down to under 5 cents a unit in some countries. So in India, for example, we'll be able to deliver this for, deliver to someone's home probably for 20 cents. The postal system in India is a real problem. But other than that, it's the opportunity is different in different countries. Again, with malaria, which is the biggest killer in human history, we've got a provisional malaria urine-based test kit. It doesn't appear in any of our sort of financial information or our decks that we've been showing investors because it's too early stage, and also it has a 15% failure rate at the moment. But it's a urine-based malaria test kit that's using someone else's urinalysis test kit, but uses our mobile tech, and that is a very particular product that has a very specific target market.
This is related to that and related to malaria, and it kind of just sparked in my head.
Yeah.
Have you guys had any discussions with the Bill and Melinda Gates Foundation?
No, but it's been, it's you mentioning that is an important reminder to me, because I do, yeah, I agree, yeah, and shame on us for not pushing something forward with them, because I totally agree. It's an absolute no-brainer for us to have a dialogue with them. But again, they're not unique. I mean, I know we should be talking to UNICEF. We should be talking to Médecins Sans Frontières. There are lots of angles for this.
So you mentioned investors. You've raised close to $2 million at this point.
Yep.
And what does that look like moving forward? Is this something that is an investment-intensive business, or can you generate cash flow from this quick enough?
Well, we will be generating cash flow this year. So, I mean, we won't be profitable this year, and I think it'd be very naive for us to pretend that we would do. But there will be a positive margin on every product that we do sell this year. I think the reality with our business is either go big or go home. So we are going big, and we don't have a huge overhead. So right now, I think we've got like $700,000 in the bank, maybe $650 actually, $1,000 in the bank. So our burn rate's fairly modest. We're burning like $65,000 a month, but we're about to raise $3.5 million. So I say about, we've just released our deck to do a fundraising. So I think we need to raise money now in order to ensure that we've got a decent.
How do you come up with $3.5 million? Talking about we got to go big. We got to
It's just the exchange rate from the fact that Brexit is really on our currency. That's the reality. So,
but how do you come up with that number, regardless of the exchange rate? Why not go bigger?
And then, someone said that to us yesterday. You're raising too little. You valued your company you should be asking for more at a high valuation. Finding that overlap between the highest price you can ask in a fundraising and making sure that you get the money, you've got to make sure that you get the money, and there's a huge amount of time and resource that's spent on fundraising. The amount of pitches you have to do in order to find one investor is considerable, even when you have a seriously hot proposition at exactly the right time. You need to make sure that you set the price at the point that you'll get the job done. So we valued our business at, I think, 12.5 million sterling. I don't know what the dollar conversion is. So we're raising 2.5 million sterling at a 12.5 million pre-money, and I think we'll get the job done at that. We're pre-revenue right now, so I think asking for more than that is greedy, but I think we're giving away enough equity that offers meaningful upside. So it's just an equity funding round. We're not doing. I've learned that mistake from a past failure.
We talked about some of your mistakes and how this one feels different. One way that I think it feels really different is this idea of a co-founder that we've talked about a lot. What does it mean to have a co-founder in this endeavor, and how has that adjustment been as you've launched like 6 businesses by yourself?
Okay, well, having it sounds really sad and lonely, but having a friend, and in the front line, is great. Well, there you go, you guys. You guys have each other. Let's have a hug moment. I think I don't know. I mean, it's so light and day. I cannot believe that I got to my late 30s before realizing I couldn't do everything by myself. I look back on how much time I've wasted, and the reality is delegation. When you're delegating to people that care and actually share your ambition. For us, this is about disrupting healthcare first. And if we get that right, then we'll make money. If we don't, then we fail. So this is not about making money first by offering people a product, especially, we're not trying to target the worried well. We're launching a product to target symptomatic people and provide them with results that they need to take the follow-on action that they need. And having a founder in that whole mix, especially one that has a very specific experience in this space. Dr. Andrew Botham is a highly regarded, incredibly respected guy in the diagnostics field. He runs a very large laboratory within the NHS. Fortunately, he's only contracted 40 hours a week, so he doesn't need to sleep. He spends the rest of the time working for Testcard. So it's great, is the long-winded answer to your question.
What's the rest of your team look like?
So there's only 6 of us. So we have Chris Hewitt, who's our head of UX, Nazco, Lance, and our chairman, George Sutherland, owns a company called Sutherland Healthcare in the UK, which is a small supplier to the NHS, but he's sort of the grey hair in our organisation. I say that I've got some of my own, but he's been invaluable to us. But our team will grow over the next few weeks and months, and our iOS team, I mean, those are those 6 people. I mean, there are another 2 developers that we've got, that's Marius and Chris with a K. So we have a small office in Sofia in Bulgaria, and that was less about cost in Sofia and more about actually competence. We were just blown away by the level of quality in coding. One of our lead developer is also an incredible, he's world-class mathematician. So as maths is a fairly critical element in our proposition.
So we opened this up talking about kind of the British temperament that you see, this kind of proclivity towards risk aversion. You said that Zuckerberg, if he was British, would have sold for $1 billion.
Unquestionably.
We talked about how you've had some exits of your own. My question would be, this opportunity seems very good, right? There's high margins. It's in a space where there's a lot of acquisitions happening. Is this something, you keep on saying, I want it to be big, I want it to be huge, I want it to disrupt healthcare.
Yep.
If you get the $1 billion offer in 2 years, is that, all right, exit time? Or is it, I want to build this thing up till...
No, the answer to that question has to be, and it should be for... I don't want to make the British mistake. I mean, the right answer to the question is $1 billion more than the company's worth right now and more than its immediately executable opportunity? If the answer is yes, if it's disproportionately more than I'm able to realistically execute, I have a duty to my shareholders in order to take the offer. However, if we still see, and I imagine we probably would, phenomenal scale opportunities to scale a business globally for considerably and achieve a far greater outcome, then no, we're not going to. I don't want to sell for $1 billion. You could change it to $10 billion. I mean, the reality is $1 billion right now. Of course, we'd say yes. Someone would be stupid to offer that kind of money. But once there's traction, I agree. It'll be an interesting dilemma to have.
Great. Well, thanks so much for being on the show.
Thank you for having me.
If listeners of the show want to learn more about you or Testcard, where should they go?
Well, they should go to testcard.com, testcard.com. They can reach out to me at luke@testcard.com. And you can find me on LinkedIn. So, yeah, thanks very much for having me. I really, really enjoyed talking to you guys.
Hey, everyone. We're here at CES, and today's podcast is brought to you from the Blue Microphones podcast suite at CES 2019. You probably know Blue from their best-selling Yeti mic that's all over the internet. In fact, Jay and I built Upside on the back of the Yeti mic. This week at CES, Blue is announcing the Ember. It's a new studio XLR microphone for professional recording, YouTube production, streaming, and podcasting. It's $99. Blue offers a full range of premium USB and XLR studio mics, which we're actually recording with today. From podcasting to YouTube to music, if you're a storyteller, Blue wants to help you amplify your voice. Visit bluedesigns.com to learn more.
All right, Eric, we just spoke with Luke Heron of Testcard. Now, let's hop into our deal memo here and talk about the opportunity ahead of Luke and this company.
Well, how about we start with the founder, which is, I think, somewhere we like to start on Upside. We had a very unique perspective on this founder because it came on the heels of talking with Feng from Wubo. So Feng went to the MIT of China and then the MIT of MIT, and he got his PhD, and he's very academic by nature. And then we contrast this with our very next hour, like literally less than 5 minutes in between. Now we're sitting with someone who's a high school dropout. And it's just crazy that entrepreneurship is that far-reaching.
For sure. I think you're drawing a wide chasm between Feng and Luke that maybe not super wide in terms of intelligence.
Right. Luke. Yeah, that's not what I meant. What I meant is that they're both founding and creating great companies. And on paper, it looks like one of them has this incredible like academic resume and the other one doesn't. And I think that entrepreneurship levels the playing field. I think that starting a company isn't predicated on having the best CV.
Right. Totally. Yeah. I mean, I was impressed with Luke in his own right as far as schooling goes. Sure, he dropped out, but to get into St. Andrews after being a high school dropout because he worked his way from the mailroom to the trading desk at Merrill Lynch, I think that's pretty impressive in its own right. But yeah, Luke, definitely from a different background than Feng, has a fascinating story though. I was really, really kind of enthralled with him talking about his journey up to this point of Testcard, going through the story of Bipost, taking on loan notes, as he said, and then eventually losing control of the asset, even though it had pretty major traction. Even on the website now, it talks about, I think, 500-something thousand orders that have been fulfilled to this point. So he had some level of success there. Things went south. He had to kind of collect himself and start over again here. And he had a series of other failures he mentioned before he got to Testcard. But very different background. Definitely.
I really like that he has so much experience in building companies. It sounds like it's something he's been doing for forever, whether it's small little hobby companies or large companies. It's just something that he's probably learned a lot through. And one thing that's interesting is that every company he started, he was the sole founder. And this one is a little different.
Yes, strikes me as sort of a classic opportunist. And I doubt that he ever thought he was going to start a medical device company or a company trying to disrupt the medical industry. But now with his co-founder, Dr. Andrew, he's doing just that and going through FDA trials. But it's definitely a different form factor than you see most medical devices. And the level of complexity here, he took what seems like a very complex thing and made it so shockingly simple, to the point where he talks about some of the components of this test card are something that you and I could go buy on Amazon right now.
Yeah, their advantage comes in their software, right? I mean, their distribution and then their software.
Yeah. At this point, I think you're right, because it doesn't seem like what they have in the card itself is not something that is patentable by them or necessarily difficult to replicate. I mean, he said these things can be manufactured for 5 cents a unit and mailed for under 20 cents a unit in most countries. So yeah, I think you're right in that the secret sauce here, the competitive advantage, unfair advantage is in the software, and that's probably why Apple is actually interested in talking with Testcard, which is something he mentioned at the end of the interview.
So let's kind of turn our attention to the other side of what I just mentioned, which is distribution. It sounds like it's going to be a partnership model for distribution. Would you agree with that?
I think that's where they're going first. They're definitely, well, it depends how you define partnership, because they're definitely trying to go direct to consumer through places. He mentioned CVS because of the Aetna partnership. I'm sure they'll probably sell through their own website. But with the Aetna partnership in India specifically, they came to Testcard saying, we want to roll a glucose test out through India. We need to be absolutely certain that there are no false negatives. But they were looking to roll that out through the entirety of India, which is a huge, huge deal for a company that is not yet in market, to be having that type of traction with Aetna, to be having so much interest from Apple, and this company launched in 2017.
What does that mean for the market size of this?
I think this gets to one of your points in a previous episode, which is it's a really big number because they have multiple tests now. I mean, right now, they have a glucose, UTI, and pregnancy test. They are working on a prostate-specific antigen test. They are working on a malaria test. So those are 5 tests alone with their own different markets of huge populations that are human problems and not, country-specific problems. That being said, they're going to need to have the user to have a smartphone to use this, so that breaks things down. But whether it's a cop-out because I didn't find these specific numbers or not, I think the answer is it's a really big number.
I'd agree with that. I think that there's 3 market sizes. And I guess we haven't really broken this down before. But there's the under $1 billion market size, which is you have to dominate that market. You have to be the leading player in order to get some sort of angel or VC funding or have a path to do that. There's the $1 to $6 billion market size, which I think we see a lot of companies somehow come in with a total addressable market of around $4 billion. I don't know if you've noticed that trend as well, but on Upside, for some reason, there's been 6 companies that have come in with a $4 billion or a $2 billion, somewhere in that range, market or total addressable market. Then there's companies that are in this nebulous $6 to $20 billion total addressable market region. And those ones are okay, there's a lot of assumptions we have to make. It seems big, but it's not immediately off the back of the napkin just monstrous. And then there's the ones that are just so big that putting a number to it just feels kind of 1, impossible, and 2, useless, because the idea is that it's huge, especially when you're thinking about it from investing from an angel perspective. I'm not sure if this opportunity fits in that 3rd or 4th bucket.
I think Luke would say that it fits in that largest bucket at the end because his goal is to just disrupt the accessibility of healthcare. And I think you could say that anybody who is trying to access healthcare is looking for something that makes it more accessible, which is just about everybody. I mean, he talked about men being particularly bad at going to the doctor. This creates a whole new way for men to find a binary outcome to a binary question, as he stated, for a whole suite of different conditions. And I think that's super valuable. I think it's a very compelling value proposition. Something I said on the show, I think he's actually, if he's really going for a $3.99 price point, I think he's really underpricing himself to even still be a huge factor better than what is available to men right now.
So I think that view of the $3.99 price point, let's just do some math. Let's do a little bit of back of the napkin math just to see how big this opportunity is. Let's say that everybody in the world who has an iPhone 6 or better uses all 5 of these tests. And the weighted average cost of those tests is not going to be $3.99. He said that's going to be the US, UK, Western world price. But he said India could get as cheap as 20 cents. So let's say, and there's a lot more people in India, just in general. But there's also probably a lot more people with smartphones in the United States. So let's say that balances out 50-50.
I think he said they can deliver it for under 20 cents, as in actually distributing it through the mail. I don't think he was saying that he was going to charge as low as 20 cents in countries like India.
Okay,
although it seemed like Aetna, the partners, were the customer for some of these countries.
Yeah, I had understood that it was going to be a very low margin proposition because of the quantity and traction they would get with using Aetna as a partner. So let's say that they keep some margin and it's $1 instead of $4. So then your average test card sells for $2.50 across the world. There are 2.5 billion people with smartphones. Let's assume all of them have an iPhone 6 or better. Not true, but let's just assume that. That means your market size is $6.25 billion.
If the individual buys one test card.
If they buy one test card, correct. So then you multiply that by 5 if they buy all 5 test cards. But not every man in the world is going to buy a pregnancy test. Not every woman in the world is going to buy a PSA test. So we cut that down. Let's just call it 3x that. That puts you at like, what, 18.75 billion?
Yeah, I'm still sitting in I think it's a really big number camp.
Sure, it's a big number. I just don't know how often people are going to take these tests. I guess that's my biggest question right now.
And that got to one of my shadows that I think I've talked myself out of being too concerned with, and that is the real life accessibility of getting one of these things, right? So he mentioned retail distribution into places like CVS because of an Aetna partnership being something he's pursuing. He said we could probably next day ship it, but if you're next day shipping something, you're probably not doing that for the 20 cents that he talked about. It really changes the value proposition and the price. But some of these things, like a pregnancy test, I'm going to want to know now. And so whether I think that Testcard is more convenient or not, am I going to wait a couple of days if I can't find retail distribution to get the pregnancy test card? I don't know. On the other hand, things like the prostate-specific antigen test, if they get that through FDA trials, that's super, super valuable and compelling to me to wait a couple of days, because you're probably waiting a period of days, if not weeks, after going to the very uncomfortable visit of going to the doctor for things like that. That being said, it might be something where if it actually is $3.99 for a pregnancy test that can give me a binary result right now that I believe to be very, very accurate, I might stock up on that. I might have one of those on reserve.
You just keep pregnancy tests like in your closet?
I think there's a generation that would.
Are you part of that generation, Jay?
Yeah.
All right. I guess I can see that. I mean, I do think that the undercutting of cost is like insane, especially if it's as effective as Luke claims, because a pregnancy test right now it's got to cost, I don't know, what, $10, $20, $15, $25, somewhere in there?
Yeah, I don't recall, but it's more than $3.99.
Yeah. So I think that market is one that they could break into pretty easily, pretty quickly. The other ones I think are slower penetration, and that's kind of getting your doctors on board, that's getting people educated, that's not like need-based or not urgent need-based. They're more, hey, we also have this.
Well, I think that the STI test, again, I think there's a generation that would really use that and probably, again, might even hold some of that on reserve.
That, with the STIs, you could partner with colleges with their health services and just have those things ready, because I feel like that's where most people go to learn about, all right, how do I even get tested for this stuff that I'm hearing so much about?
I think we're asking some of the wrong questions, though, or considering the wrong opportunity a little bit, because the use cases that he's talking about, the STI, pregnancy, UTI, maybe even the glucose screening, I don't think that's as big of a disruption as the prostate-specific antigen that he was talking about, the PSA test, which is not being done with urine now. I think that the real opportunity for Testcard is if you believe they can hit that, get that through FDA trials, and have a whole different method entirely for something that is a very invasive test right now, that is long and drawn out and expensive and not fun to go through. I think that's a much bigger innovation and a much bigger value proposition, and probably what you're betting on if you're betting on Testcard.
I 100% agree with that. I think it's funny because I think our brains were both going the same way as we were kind of walking down the paths of the different tests. And I completely agree. And I think that the PSA test is an indicator for other types of tests that can be in this same vein down the road. So as they get this one kind of figured out, and if it works, then this kind of becomes the same value prop as a drug company where, all right, we can roll out some R&D to find a new test that is right now very hard for people, but we have distribution through our pregnancy, glucose, STI. So we've created the distribution networks. Now all we have to do is fund R&D to the point that we can get to a test that provides similar efficacy or better efficacy to what is currently being done in a painful or intrusive way, and then roll that out to a wider audience so that they could do it in the comfort of their home with their smartphone. I think that is definitely the value prop here. So you use your first tests to get distribution, and then your later tests to get penetration.
Luke is the first founder and company that's been based in the UK that we've talked to. Really kind of a geographical stretch for us, but also something that he gave a perspective I hadn't heard before on English, we'll call it, perspective versus American perspective. He said, Americans embrace entrepreneurship in a far more pragmatic and open-minded way than the Brits do. He said Brits are bad at failure and success. And so he had this, you can almost like see it playing out in real time, this dichotomy of wanting to go bigger and also being rooted in this culture that doesn't think that way. Because, he's saying this is a really go big or go home proposition. We're raising $3.5 million. Or this is a really go big or go home proposition. We have a $12.5 million valuation right now. You can see like this dichotomy playing out, even though they're only burning, they're burning $65,000 a month, which for a medical device company with two adult entrepreneurs, one of which is a doctor, pretty low burn rate. It's good to see that capital efficiency. But at the same time, you're saying, well, why not bigger? And we explicitly asked that. And it seemed like his answer was, we don't think we need it. It actually feels a little bit greedy. And I want to hear, after the interview, your take on that.
So I'm going to address the first part first, which is this idea of American entrepreneurship, which is so funny because the idea of American entrepreneurship is essentially Silicon Valley entrepreneurship. And I feel like that's what he was referring to. Whereas the culture of the English or the British feels a lot like some of the things we hear around the Midwest, where it's more reserved, less bold, less, I don't want to say ambitious, because I don't think it's less ambitious. I just think that there is a layer of risk mitigation on kind of everything from investors to entrepreneurs. And maybe that's smaller in the United States, but I think it still exists. And I think I still feel that culture in the Midwest, as opposed to when you're thinking about New York or Silicon Valley, and it's okay to fail and it's okay to be successful. It's okay to be a billionaire and it's okay to have 8 failed companies. But I think it's a little different in the Midwest.
So what are you thinking about 6 to 18 months from now?
I want to hear more about the partnerships that Testcard is entering into and if those have gotten to market. It sounds like if this Aetna thing clicks, that's going to really challenge them operationally to make sure that they can get this large volume of test cards out, delivered, make sure that their software doesn't crash when hundreds of thousands of people are running tests, likely within the same week or two. You'll probably find some kinks and some bugs, and being able to work through those operationally, I think that that'll be huge. So I want to hear more about the partnerships that they are creating and the operational fixes that they're putting into place because of those partnerships.
Well, Eric, I'm going to surprise you here. I'm not looking for revenue.
What? Jay, that's your thing.
That's not what I'm looking for in this case. I agree with you on the partnerships. I'm looking to see specifically, I would like to know the progress on the FDA approval for the PSA test. I would also like to do a reevaluation of the competitive landscape to see, have there been copycats? What type of traction do they have? What is Testcard's moat here? And it may be that they form partnerships faster and Aetna says, nope, we're going with Testcard. And Apple says, nope, we're going with Testcard. But I'm not sure what is, at the end of the day, protectable here versus trying to employ the technology, do it really well, and be the first one that comes to mind for consumers. And I think that if we look 6 to 18 months from now, it's important to see if anything else is kicked up.
Love it. So, Jay, if people want to interact with this episode, if they want to find or talk with us, where do they go?
We'd love to hear your thoughts on this episode, guys. If you have thoughts about Testcard, tweet at us at UpsideFM. Or if you would like to give us some feedback directly to Eric and I, you can send an email to hello@upside.fm. And if you enjoyed this episode, go leave a rating on iTunes. That helps us bring on high-quality guests to the show. And we'll talk to you next week. That's all for this week. Thanks for listening. We'd love to hear your thoughts on today's guest, so shoot us an email at hello@upside.fm or find us on Twitter @UpsideFM. We'll be back here next week at the same time talking to another founder in our quest to find upside outside of Silicon Valley. If you or someone you know would make a good guest for our show, please email us or find us on Twitter and let us know. And if you love our show, please leave us a review on iTunes. That goes a long way in helping us spread the word and continue to help bring high-quality guests to the show. Eric and I decided there were a couple things we wanted to share with you at the end of the podcast, and so here we go. Eric Hornung and Jay Klaus are the founding parties of the Upside podcast. At the time of this recording, we do not own equity or other financial interest in the companies which appear on this show.
All opinions expressed by podcast participants are solely their own opinion and do not reflect the opinions of Duff & Phelps LLC and its affiliates, Unreal Collective LLC and its affiliates, or any entity which employ us. This podcast is for informational purposes only and should not be relied upon as a basis for investment decisions. We have not considered your specific financial situation nor provided any investment advice on this show. Thanks for listening, and we'll talk to you next week.
Never mind, bro, that can't be matched. I'm lighting it on fire, used to run victory laps, and still I'm not even tired. It's all about the timing, yeah, that's what they say. Well, I'ma keep on rhyming.